Hello, welcome to another episode of Matters of the Heart, brought to you by Haverhill Community TV and Pentucket Medical Cardiology. My name is Isaac Pourati. I'm here with Dr. Bilazarian, who's going to talk to you about safe medicine disposal.
Great. Thanks, Isaac, for the introduction. And so a topic that I've had some patients come up with recently. They actually asked today. A patient came into my office with a bottle of a drug called metformin, a diabetic drug, had been prescribed by the patient's primary care doctor, and it was a full bottle, a 90-day supply, 2 a day, so almost 180 pills. Had taken 2 or 3 tablets and said, I can't take this. What do I do with it? Patients have asked me over the years, and I decided to prepare this conversation today with you and for our audience about what we should do and what are some of the issues about medication storage and disposal. And I thought I would go through some things that are available from the Food and Drug Administration and the Mass Department of Environmental Protection, and share some of that information with our audience today. So I'm interested in what your experience is as well on this as we go through it. But some of the information I found out was interesting that Americans, of course, you and I know, are using prescription drugs with a lot greater frequency. According to the CDC, the Center for Disease Control, about half of Americans are taking at least one prescription drug. I'm taking one. I'm taking a cholesterol medication, for instance. And a third of patients are taking more than 2. So it's a lot of medicines in patients. There are 400 million Americans, so if 200 million are taking one drug and a third of us are taking a couple, there's a lot of drugs out there, and when patients change drugs, there are a lot of issues. Of course, we know we've talked on this program about how these drugs are really wonderful in reducing pain, reducing suffering, prolonging life, reducing problems like heart attacks and strokes. So we really believe in these drugs, but of course the pitfalls of them are that they can cause harm if they fall into the wrong hands. And that's one of the things I want to talk a little bit about today. Prescription medications are now the second most commonly abused drug after marijuana. So there's marijuana is the number one illegally used drug or inappropriately used drug, and prescription drugs are number 2. And the National Institutes of Health estimates that nearly 20% of people in the U.S. have used drugs that weren't prescribed to them. They used a drug that was either a painkiller or a sedative or a tranquilizer or a steroid for some reason other than what was prescribed. So it was taken from either a family member or some other friend prescribed or offered it to them, and they took it. So there's a fair amount of inappropriate drug use, in part because there's a lot of drugs around. One thing that I want to mention is how big a problem is. Some people will say, well, that seems like not that big a problem, but it really is a pretty substantial problem. This use, inappropriate use or accidental exposure to medicines is a major source of unintentional poisonings in the United States. In 2007, for instance, 250,000 Americans called a poison control center and reported that they had used a medicine that was accidentally ingested. And 5,000 of these episodes were from children under age 6. So they had gotten it often in a grandparent or parent's cabinet and had used it. So one of the goals that I want to emphasize today is that keeping medicines safe in a locked cabinet, preferably, or certainly out of the reach of children, is really critical. But there are some really important pitfalls to this. And one thing that I think that is a lesson that I learned from this review is that one study showed that in 45% of episodes where children had been exposed to a drug, they had gotten it from a tamper-resistant pill bottle. So I think a lot of us think, oh, it's a tamper-resistant pill bottle, the child can't get it. But almost half of these children that have gotten into it were able to open a tamper-resistant bottle. So that's not enough safety, is something to mention. The FDA on its website has 3 terribly sad cases that they report of young children, aged 2 to 4, each who had gotten an opiate, a drug that's a powerful pain reliever that's appropriate for patients after surgery or under certain circumstances. But all of these children had ingested an opiate. One was a child who had used a very long-acting, a 2-year-old child, was found to be acting inappropriately at home, was brought to the emergency room, was tested, was given the medicine that's used for inappropriate drugs, charcoal, to try to absorb this. Child seemed okay, went home, and later died at home and couldn't be resuscitated. Another case they report, a 4-year-old child was similarly acting unusually, taken to an emergency room, given some charcoal, treated appropriately, it seemed, went home and died. And that child on autopsy was found to have ingested a patch, a fentanyl patch. This is a patch that patients who have chronic pain syndromes put patches on. after one day it's taken off and thrown away, but it still has drug on it, and it's thought that this child, for instance, took it out of the wastebasket, ingested it, it still had active fentanyl and was enough to actually kill the child. And a third case similarly also of opiates. So the opiates are a big area of concern for safety with regard to children. And I was thinking about these cases, and you can sort of read about the statistics, and you can read about all of these issues. But we don't think I think enough about, most of our elderly patients that you and I take care of with heart disease. They live largely for their family and for the joy of being around their grandchildren and the tragedy it must be of having a grandchild die under these circumstances. Our state does not do, the state of Massachusetts, the state of New Hampshire nearby, doesn't do very much to sort of formally, on a statewide basis, to help with disposal of medicines. So patients who are changing medications and whatnot, who are left with medicines, like I told you, the patient of mine today, we don't really have any kind of formal statewide program for this. The state of Maine has done this in a very formal way since 2007. They actually have envelopes that they send to patients. They can put the medicine in, send it into a place where pharmacists review the medicine, and they do a variety of things. They dispose of it properly, but if these medicines are in blister packs or are in ways that they can be reused, they actually are reused to give to patients who can use them again. So it's a pretty exciting way to sort of save money and be safe. For the state of Maine, where there is more data because this is now being collected, in 2007, nearly 90% of drug deaths in that state were caused by prescription drugs. So it's pretty unbelievable how much prescription drugs, either they're being stolen or they're being used inappropriately or they're being bought inappropriately, are actually causing drug deaths. In the Maine, the Drug Enforcement Agency in the state of Maine reported that 23% of all arrests are from prescription drugs. So people who are, getting these drugs, oxycodone has often been in the news as a drug that people are getting. So 1 out of 4 almost arrests are for prescription drugs. So that's a really significant problem. So what's led to the state of Maine and other states have started to become on board is to try to figure out ways to safeguard drugs. And these, I've already talked about this, but just to review, the desire to have drugs be safely stored and then disposed of does several things. One, it curtails these childhood overdoses, these tragic cases I suggested, as many as 5,000 nationally of drug overdoses, but I mentioned several deaths. It restricts household drug theft. If as a community and a state we do a really good job with getting these drugs out of houses when they're not being used, then people who want to get them inappropriately, thieves and whatnot, won't be breaking into houses because they'll be less likely to be there. It limits the accumulation of these drugs in houses where they can often be confusing. I'm sure you've had the experience, I know I have, of patients who taking double of different drugs because there's confusion. So we switch from one class of drug to another class of drug, or we switch between drugs in the same class. You and I may use a drug in a beta blocker class called metoprolol. Sometimes we think a drug called carvedilol is better, as an example. But if a patient doesn't get rid of the metoprolol and is taking both, that's very dangerous because they're essentially double dosing on a drug, as an example. So we want patients to really try to get rid of the older drugs or make sure that they're clearly segregated in the house for safety. Another area that's really become interesting is one of the older ways that physicians and patients were recommended to get rid of drugs is to dump them down the toilet. That is now not recommended any longer except for a few drugs. And the concern is that many drugs are now being identified that they're getting into our water supply, or they're actually going into our rivers, Merrimack River, going out to the sea, and they can cause significant problems with our environment. Drug class antidepressants or the birth control pill or oral contraceptives have been shown to have real impact on fish reproduction, and particularly on shellfish. And here in the seacoast area, that obviously has significant impact for our health as we eat these fishes and shellfishes, but also on the livelihood of people who make a living in this industry. Of course, doing a good job with this might, if we did a good job, as the state of Maine seems to be doing, we might reduce waste in the system if we could reuse some of these drugs if they come out in blister packs or other kinds of ways that can be safely reused. So that's what I want to make mention about this issue about the state of Maine and this drug disposal issue, and want to talk a little bit about what their experience is about what's coming out of people's homes. In the state of Maine, they found that 90% of these returns were prescription drugs, 10% were over-the-counter drugs, 10% of the drugs were returned were controlled substances. And controlled substances are these kinds of drugs that are like opiate drugs, painkillers, sedatives, or depressant medications, or sleeping type medications are these kinds of meds that are often sought by people who want to abuse prescription drugs. And that was really the key findings, I think, of that. One of the things they found was that a variety of these envelopes that were being sent in at the state of, in the state of Maine had really substantial so-called street value, that if they had been left in someone's home, they could have thousands of dollars of value, so therefore increasing the chance that people would break into homes. One envelope they cited had $7,000 of street value of these kinds of pain medications and sedatives. So the main program, called the Maine Mail-Back Program, has really given us a lot of insights about what's out there. In their first phase of the program, they collected a ton, over 2,000 pounds of drugs, and they estimated that about 80% of that might have been flushed down toilets. So they actually saved from the environment over a ton, half a ton of drugs that would have been put into streams and waters and other kinds of places that ultimately would have been an issue. The issues that came up was that why did these people have these drugs left over? And again, the data from Maine has been very helpful. 20% of the cases were that the patient who was using the drug actually died. Of course, our senior citizens, they have a 3-month supply of 7, 8, 10 drugs, and they die. They now have a lot of pills around that need to be disposed of. So 20% were from a patient who had passed away and no longer needed the medicines. A second cause, 27%, was that the physician said that they didn't need to take it anymore. They were switched, an example that I used, or the patient didn't tolerate it, or another medicine needed to be used for more efficacy. And another cause, 11%, 1 in 12 approximately, had been because the patient had some kind of allergy to the medication or some kind of negative reaction. And 18% of the time, patients didn't need the drug anymore. Perhaps they were prescribed a drug for pain after surgery. They took it for 2 or 3 days, and they had a great recovery, and they no longer needed the drug. So these were some of the common reasons that we've experienced, but very common type reasons why we would expect patients to have extra medications at home. The reason why, when they surveyed the patients, they said, well, why did you decide to participate and send these drugs in? Patients had, pretty reasonable reasons. They wanted to avoid damaging the environment, which is becoming an increasingly understood important reason to not just dump medicines into the toilet. They were concerned about drug safety, this whole issue about confusion at home. Some of the other issues that come up with me, and I'm sure come up with you as well, is you have a patient who might be on 8 or 10 drugs, and their spouse is on 8 or 10 drugs. So we now have 16 to 20 pill bottles between the two. And then we have, changes, so we have multiple pills, so it can be quite confusing. So getting rid of the ones that are no longer active is really an important thing to avoid this for drug safety. And then other reasons that people and patients who had participated in this main program cited was they want to avoid this, what's called drug diversion. It went to the wrong person for the wrong reason, or it was stolen or some other issue. And the last reason, of course, is the one I cited, that the drug had expired or was no longer useful. So I think those are some of the issues that we have been dealing with, and I'll just cite a few more information that, in terms of this whole area about drug abuse, the National Public Health Problem for this now says that there are more deaths from prescription drug overdoses than from heroin in America. And that prescription monitoring programs are underway in 34 states, not available in Massachusetts or New Hampshire, regrettably, but it's one of those things that it likely will be on the horizon, because it seems like there's becoming a national interest in this. What we're hoping at our practice level at Pentucket Medical is that the use of electronic databases are really going to help us. One concern that I think practitioners like us have is that some patients go around doctor to doctor and try to collect these medicines, and then they may sell them or use them inappropriately. So we are just on the verge of having an electronic database, so we'll be able to see if a patient who asks us for some kind of a sedative or a painkiller has got this prescribed. We'll actually be able to look, have they gotten it prescribed, because other physicians will be adding to this database. So you can see if a patient's been getting it every day for the last few days, and we'll be able to know and not prescribe it if the patient's been getting it frequently, because that's obviously an indicator that the patient's getting more than they really should. we've put into practice in our own practice some strategies to try to be very clear that only one physician in our group will prescribe rather than multiple physicians will prescribe if a patient has a real need for pain. One of the issues here, of course, is that these people who abuse the system actually hurt the people who really need these drugs, because we have to be extra cautious now because of the abuse in the system. Many patients, most patients, need these drugs and need them to get them on a regular basis, so we actually are handicapping those patients who really need them appropriately. So that's some of the basic information that I wanted to share. So I'll just sort of skip ahead and say, what is the best way to try to dispose of these medications? So the FDA has made some basic recommendation. They say most drugs can be thrown into the trash, and consumers can get rid of most drugs. The only drugs that really should be flushed down the toilet are ones that specifically say it on the label. And they have a list on the FDA website for those people who want to look them up. But all the drugs, I can just tell patients, are the opiate-type drugs. So those drugs are the ones that should be flushed because they thought to be able to be dissolved, and that the risk to the environment is low, and that the benefit for safety, for like the children examples I cited, or for sales or theft reasons, are better to use it with flushing than disposing them in the wastebasket. To dispose them in the wastebasket, patients are recommended to cross out with a black marker, an indelible marker, or a marker like a Sharpie marker, their name and all identifying information, but to leave the name of the drug on the bottle so that if someone does ingest it, patients can get help with it. Some people have recommended that if you have a bottle of a certain kind of drug, to pour some water or some soda in it and then seal it again, with the hopes that that will discourage people from using it because it will dissolve and it'll be sort of a sludgy mess, basically, rather than pills that could be sold or stolen. There are a few take-back programs. In the town of Andover, there's an annual take-back program at the police station. Here in Haverhill, there's actually the main police station, there's a container that's a sealed container that you can take prescription drugs in. Just put them in a container, drop it in like a mail slot, closes it, and the drug is then disposed of properly by an agency that contracts with the town. So some different towns have these take-back programs with the hopes by providing more of this extra medicine will be taken out of homes, reduce the likelihood for theft and the invitation or the temptation for people to break into homes and use them. So I would say that that's the main crux of what I was hoping to review today, these strategies for throwing them out really should not be in the toilet any longer, really should be in the wastebasket, and that scratching out your name or taking them to one of these take-back programs is the best strategy.
Great. I was going to ask you, is there any medication that it's safe to keep in the house? Just in case you need it in the future?
Well, it's a good question that you ask. I mean, I know that, for instance, in the non-controlled substance, the drugs that aren't like opiates or sedatives that have a temptation for being stolen, drugs like blood pressure medicines or cholesterol medicines, sometimes I tell my patients when we make the change to segregate them from their usual medicines, to put them in the back of a closet, somewhere like in the back of a closet or in a bag somewhere that's clearly not in their medication group. This is for several reasons. Number one is it's very helpful to reduce the confusion possibility. Another thing is that it's been my experience is that when someone goes to the hospital and the ambulance comes in, they scoop up all the medications, and then if there's active and inactive medicines, we don't really know which ones the patients are on, so we can't help them when they go to the hospital. But it does allow, if they do have it in some other place, the opportunity to go back if we decide to switch back, so the patients don't have to have the cost of getting the medicines again. So I would say in general, most medicines last less than a year. So once a medicine is more than a year old, they really should be getting rid of them. So I would just say that in summary, hopefully this has been a useful strategy for review of this safe disposal and storage of medications. There's a lot available on the website at the FDA and some other sites. The American Pharmaceutical Association recommends the 3 simple steps that I said. Do not flush unless it's one of those specific ones like opiates. When tossing unused medications, protect children by sealing them and putting them in a place that they can't get them to. if they're in the wastebasket, some people even recommend that they be mixed with things like coffee grounds or other kinds of undesirable things so people won't get into them. I mentioned the idea of adding soda or water to the bottle and then sealing them that way. And the last thing is there's certainly resources, but one resource is a pharmacist at your local pharmacy to give recommendations about safe storage and disposal. So hopefully an instructive and useful tidbits for our audience. Until next time, I'm Seth Bilazarian from Haverhill Community Television. Thanks for joining us.